Good afternoon. Welcome to this presentation about integrative health and cancer care. Our speaker today is Dr. Masey Ross. In addition to being the medical director of Massey's Integrative Health Program, Dr. Ross is a medical oncologist who specializes in the prevention and treatment of breast cancer. She sees patients at 3 different locations and is a physician member of the high-risk clinic where she focuses on breast cancer screening and prevention through lifestyle modification and medical risk reduction. Dr. Ross is also heavily involved in clinical research at Massey Cancer Center. She's the director of the statewide clinical research affiliate network, which aims to help more patients access the latest cancer therapies. She emphasizes a holistic approach to cancer care and is here today to give us more information about what holistic care involves and what's meant by integrative health. We will be recording this, so if you have any questions, please enter them in the chat feature and they will be addressed at the end of our presentation. Dr. Ross, thank you for being here today.
Thank you, Susan, for the introduction. Okay, I'm going to share my screen. So as Susan mentioned, I'm going to be talking today about integrative health and cancer care. This is what I plan to cover today. So I'm going to talk a little bit about background of integrative health. We're going to focus a little bit on some of the terminology and defining integrative health, so just so we can be clear about what we're talking about. We're going to talk about some of the goals of integrative health therapies, and then we're going to review the infrastructure and current program offerings through our integrative health program at Massey Cancer Center. I'll also try to share some resources at the end of the presentation for your reference. So a little bit of background, in the 1960s and 1970s, that's when we really started to see growing popularity of cancer care that encompassed or incorporated the mind, body, and spirit. And at that time, 2 basic categories were born out of this growing popularity. One, which was termed complementary, and the second, which was termed alternative. And subsequently, these were referred to collectively by the acronym Complementary and Alternative Medicine, or CAM. And so much of the older literature or older research and reading material will collectively refer to this CAM, to Complementary and Alternative Medicine Therapies, as CAM. We now know that can be very confusing and imprecise, so that's no longer the preferred terminology. And so the preferred terminology now is integrative. Integrative is pretty synonymous with complementary. What that really means is it employs the use of adjuncts to traditional oncologic care. So therapies that are used in addition to traditional or conventional cancer care. That's contrasted from alternative, which really refers to therapies that are used instead of conventional or traditional care. Alternative therapies often refer to unproven treatments that are not considered evidence-based. They can often falsely promote anti-tumor or falsely be promoted as anti-tumor treatments or sort of cure-alls. And many times they lack biologic plausibility or rigorous evidence for safety or efficacy. And some can be quite costly. So integrative oncology simply means incorporating integrative therapies or integrative health into cancer care. So it's really a comprehensive or holistic approach to cancer care that focuses on the physical, emotional, and spiritual well-being of patients. And as such, it employs the use of therapies, again, that complement or are used in addition to conventional care. And when we talk about conventional care or standard care or traditional care, what we really mean by those terms are things like surgery, chemotherapy, radiation, and endocrine or hormonal therapy. These are a couple other definitions that are offered by some of the national and international leaders in this area. So the Society for Integrative Oncology in 2019 defined integrative health as care that focuses on the whole person, is informed by evidence, and makes use of all therapeutic approaches, and incorporates healthcare professionals and therapies to achieve optimal health and healing. The National Center for Complementary and Integrative Health of the NIH defines integrative healthcare again as comprehensive, often interdisciplinary, and an approach to treatment, prevention, and health promotion that brings together complementary and conventional therapies. So you can see integrative and complementary sometimes are used interchangeably, and that is very different from alternative therapies. So there are lots of different types of integrative therapies. It's sort of an umbrella term. We tend to categorize them, and much of the research and literature that you'll read categorizes integrative therapies into some basic categories such as mind-body intervention. So that incorporates yoga, mindfulness practices, and meditation. Can also include Tai Chi or Qigong, deep breathing exercises, guided imagery, cognitive behavioral therapy or CBT, and hypnosis. There are also herbs and biologically based systems that are considered under the integrative therapy umbrella, and that includes different types of herbal supplements, whether that's pills or capsules or tinctures. It includes vitamins, as well as special nutrition and diet practices. So you'll hear things about keto diets, alkaline diets, those sorts of things, falls under that category. There's also manipulative and body-based methods. And so that would include integrative therapies like massage, chiropractic care, acupuncture, acupressure, and lymphatic massage. Art therapies, which includes journaling, drawing, music therapies. There are energy therapies such as Reiki and healing touch, and then exercise and physical activity. So this is not an exhaustive list of integrative therapies, but just some of the categories that you may hear about, and some of the more common integrative therapies that are used. So the goals of integrative health can be many. They can be specific goals, such as controlling physical and emotional symptoms. So for example, a physical symptom that one might try to help control through an integrative therapy might be pain management or fatigue. Emotional symptoms might be things like anxiety or stress management. They can also be used to enhance the tolerability of traditional oncologic care or to minimize toxicities. So somebody who may be going through radiation or chemotherapy that may be having a lot of nausea, vomiting, dry mouth, things like that. Sometimes using different integrative health modalities can help try to mitigate those side effects. And also many of the goals of integrative health therapies are more global. So many of the therapies can help to improve quality of life in the global sense. One of the most important things that I think that integrative therapies can do for patients is to provide them with skills and tools to help themselves through the rigors of their conventional treatment. So to take an active role and equip them with a toolbox, essentially, that can help them wherever they are throughout the course of treatment and survivorship. So there have been many studies looking at integrative therapies. This was the results of one study that was published back in 2000 in the Journal of Clinical Oncology. And it is a little bit of an older study. So you can see at the title, again, it's talking about complementary alternative medicine. So it's using that older nomenclature, which we have since abandoned. But what they were looking at was they were looking at integrative therapy use in a comprehensive cancer center and the implications for oncology. So they surveyed patients to see why they were using the different integrative therapies. And what they found is that 73% of the patients were using them in an effort to feel hopeful. About 50% had a belief that these approaches were non-toxic. 44% or so had a desire for more control in their medical care decisions. So that's what I was just referencing. I think a lot of these integrative therapies can be a really powerful tool to give patients back some control that many may feel like they've lost during their cancer treatment. Expectations for use. So many patients reported that they were using integrative health in an attempt to improve their quality of life, to potentially boost their immune system. Some were hoping that their therapy might prolong their life or provide symptom relief, or even to improve their chance of cure. Now, I'm not saying that all of these things are possible necessarily with integrative health therapies, but this just gives you an idea of why different people might try integrative health, what their reasons and expectations might be. One important point of this study was that the majority of patients that were surveyed, so 74%, really indicated that they wanted more information about integrative therapies. And so a lot of our effort here at Massey in our program development and educational seminars has been with this goal in mind, to try to help empower patients and provide reliable and accurate information about integrative therapies. And about 5 years ago, we actually employed a survey here at Massey Cancer Center. We asked our patients at 2 of our locations if they were participating in any integrative therapies, either here at Massey or in the community. And the majority of our patients reported current use of at least one integrative therapy, so about 65%, or 95 out of the 145 surveys that were returned. And you can see that many of our patients, some of the more popular therapies that they were participating in were things like using vitamins, herbal supplements, special nutrition diets, prayer, spiritual activities, and massage therapies. So I had referenced earlier conventional care or standard of care, and the care that we provide in terms of recommendations of chemotherapy, surgery, radiation therapies, all of those are really rooted in science, and those recommendations are based off of prior clinical trials, so rigorous clinical research that's been done to tell us how we can best take care of people with particular types of cancers. And when we look at integrative therapies, there can often be limitations to research. And sometimes this can create some confusion about which integrative therapies may be safe or effective. Some of the challenges that we encounter when we're trying to do research studies for integrative therapies are that it can be difficult to standardize these integrative therapies in terms of the dose, duration, and intensity. So for example, if we are looking at trying to assess how effective a yoga program might be, there are lots of different types of yoga programs. Obviously, there may be some variability from instructor to instructor. And so especially if you're trying to look at research more in a global sense, where you're looking at studies of yoga across different institutions, it can be difficult a little bit to standardize the yoga programs and to come up with objective, meaningful conclusions from the research. And so sometimes it can be a little bit difficult to study these therapies. Another example is that sometimes there's not a universally agreed upon control. And what I mean by control is, for example, if there's a study looking at the safety and efficacy of acupuncture, many studies have tried to incorporate what we call placebo acupuncture or sham acupuncture. So there may be a group of patients getting the actual acupuncture, and then another group that's getting coming in and meeting with the acupuncturist, but instead of getting the needles inserted into the actual acupuncture sites, maybe the needles are inserted into different sites, or they may be non-penetrable or sort of retractable needles, as a way to try to tease out, is the effect that we're seeing in the research study due to the actual acupuncture, or could some of it be due to the physical interaction with the acupuncturist and some of the therapeutic benefits of the actual encounter. So all of these things can make researching integrative therapy is difficult. And so evidence of safety and efficacy may be mixed or limited in this realm. And so because of that, we really encourage any sort of integrative therapy that you're thinking about participating in to really discuss it with your physician or your care team for some guidance. Whenever we're thinking about whether or not to recommend an integrative therapy, we're really looking at two things. And I've provided this chart to sort of help with some of the framework. We're looking at, first and foremost, the safety of a therapy. And then we're also looking at what evidence is there that it can be efficacious or actually helpful or beneficial in whatever we're trying to achieve. So if you look at this chart here, what it's showing is that most therapies will fall into one of these four categories. So there are some integrative therapies that may be safe, but their efficacy is inconclusive. So meaning, probably won't do any harm to participate in them, but they may not be particularly beneficial. There are some that may be safe and efficacious. So obviously those are therapies that we would strongly endorse. There may also be some efficacious therapies, so therapies that may be beneficial, but they're not always safe. And then there is the category that, there's serious safety risks, and also the therapy may not be particularly helpful. And so obviously that category we'd like to avoid. So I'll give a couple examples of some therapies that might fit into different places in this chart. So an example of a safe and efficacious therapy, so that would be up in the right-hand corner, would be something like yoga. So yoga has been studied in many clinical trials looking at yoga for different endpoints for cancer patients. And it has been found to be relatively safe. Of course, it's taken on an individual basis, but it's a safe practice. And it has shown efficacy on several different clinical endpoints, including particularly in the breast cancer population, to help with things like anxiety and stress management. Another example of a therapy that might be considered to be safe, but the efficacy is inconclusive, so that would be in the upper left-hand category, might be some of the energy therapies, so something like healing touch or Reiki, where it's generally considered safe. Those are not considered to be harmful therapies, but we don't have a lot of clinical research showing that they have specific endpoints in terms of clinical benefit. So it's always important to think about, the safety and efficacy of any of the integrative therapies. And again, your provider and care team can help with guidance to try to determine which of the categories a therapy might fit into if there's something that you're thinking about. Along those same lines, this is a list of questions that I found on cancer.net. So cancer.net is information that's geared toward patients and the community. And it's published through ASCO, which is our American Society of Clinical Oncology. So it's very reputable, good source of information. And this is some questions that they pose to think about when you're contemplating an integrative therapy and to discuss with your cancer care team. So one is, what is the goal of the therapy? Why are you looking to participate in a certain integrative therapy? The second is, does the therapy work in combination with or replace a standard therapy? So again, this is getting at, is it an integrative therapy or is it an alternative therapy? If I use this therapy instead of a standard treatment, will it delay my standard treatment? And if so, could the delay be harmful? Will this therapy affect my chances of receiving standard treatment later? Does the person offering this therapy have a trustworthy medical license or credentials? So that's an important thing to think about when you're seeking out different therapies in the community, things like acupuncture, chiropractic care, things like that. What research is available about this treatment safety and effectiveness? So that is sort of getting at that chart that I just showed on the prior slide. What are the possible side effects from this therapy? Will this therapy work for the type of cancer that I have? And is there a clinical trial for this therapy that I can join? And that last one is really important because there are a lot of clinical trials available. So I mentioned that, there's for many of the integrative therapies, there may not be robust clinical evidence because some of the therapies can be difficult to study. But there are many clinical trials going on for integrative therapies nationally and internationally. And those, if you can join a clinical trial, if there's a trial that's available that offers the therapy that you're interested in, many times clinical trials have sort of built-in safety checkpoints and additional monitoring. And that's also a way that you can be contributing to the growing body of evidence for integrative therapies. So that brings me to our integrative health program at Massey Cancer Center. So the mission of our integrative health program is to enhance health outcomes and quality of life for patients and families by integrating high quality conventional care with evidence-based complementary health approaches to engage patients in biopsychosocial or holistic wellness. We also want to make sure that we're providing excellent patient-centered integrative healthcare through interdisciplinary collaborations supported by rigorous research and education. We have 4 program pillars, and so you can see here what we've identified, and some of this is based on the needs assessment, the surveys that we delivered 5 years ago, and what our patients identified as priorities for them as we're developing our integrative health program. And so we have 4 pillars. Those include nutrition, mind-body therapies, psychosocial wellness, and physical activity. And so this is an example of some of the programs that we offer under each of those categories. And I'm going to have a little bit more extensive list in a minute that goes through some of our program offerings. So as Susan mentioned, my name is Masey Ross, and Susan and I work hand in hand as the program leadership. We have a large integrative health committee who is actively engaged and helps with all of our program planning and implementation. And we have several other individuals that I'm going to point out on the coming slides that help to lead our programs. In terms of infrastructure of the integrative health program, so many of you may already know about our calendar of events. We have a monthly calendar of events that comes out. And if you're interested in hearing about the calendar of events, it is available on our Massey Integrative Health website. And you can also get on our listserv and have that emailed to you on a monthly basis if you'd like, so that you can keep up with what kind of events we're planning from month to month. We do have an integrative health phone line, and I'll list that at the end of the presentation with some additional resources. Marketing materials, so we have somebody that helps us, Melissa Mitchell, with our marketing of all of our integrative health offerings. So if you are on the Massey Cancer Center Facebook page, or any of the Instagram information, you'll see some of our marketing materials for the integrative health programs. We have a monthly newsletter, as I mentioned, and then we're always constantly networking and establishing relationships, both amongst other departments within VCU, and then in the community, we have several partnerships as well. So this is a list of some of our programs here currently. So we have a Ramble Wellness Walk, and I'm going to go over some of these a little bit more in depth in the slides to come. We do offer yoga classes for patients, survivors, and caregivers. We have an integrative health nutritionist, and she keeps an active blog. We also have a weekly seasonal farm stand to provide fresh produce. We have mindfulness classes and offer individual relaxation breathing consultations. We have a wig salon and offer periodically skincare and makeup program, which we call Confidently Me. We put on a variety of educational classes and workshops. One of our most popular ones is called the Healthy Living Series. We do maintain a healing garden, and we have a variety of support groups, including one called Coffee and Conversation. VCU and Massey have an active arts and crafts program as well as a music therapy program. There is a Dogs on Call program. And then we have a variety of other resources, including a medical legal partnership and honoring choices. So the Ramble I mentioned, the Ramble is our monthly wellness walk where many patients, providers, and staff join together to walk once a month. Historically, we had been doing this at Stony Point Parkway, and then over the last several months, this has actually been a virtual program, but we're hoping at some point in the near future, we're going to be able to get back to this being in person. It's a really good opportunity to, visit with your healthcare team outside of the clinical setting to get some exercise and to learn about other upcoming programs that we have going on. This is also co-managed by the VCU Women's Health team, Integrative Medicine team. And so it's a really fun event. These are some pictures of some of our past events. We always also include a guest speaker that gives a 5 or 10 minute talk about something educational. And then Mary Shaw, who I've pictured here, is our physical therapist. She's also a yoga instructor, and she joins at every Ramble walk and leads us through. You can see here in the top left picture, we're doing some stretches. So she always leads us in stretching and some exercises before we actually get to the walk. So I mentioned that we have a yoga program. So there is quite a robust body of evidence at this point to show that yoga can be helpful for a variety of different reasons. Specifically in the breast cancer population, there was a publication that came out from the Society of Integrative Oncology and has since been adopted by other major cancer societies that endorses yoga, particularly for reducing anxiety, for improving mood and depressive symptoms, and for helping with quality of life. And so we do offer a yoga program. Historically, it's been a rotating 6-week session, 6 weeks in a row. We have 2 instructors that have led this program in the past, both yoga certified with some additional training in yoga, leading yoga for patients with cancer. That's called Yoga for Cancer training. And historically, this has been also held at Stony Point at the 9109 building. But we've actually, during the pandemic, we've had a very successful virtual yoga program, which has been led by Anna Kucher, who's also a nurse practitioner and a licensed acupuncturist. And so that is a program that we're planning to continue. And if you're interested, again, you can get more information on the website or at the phone line that I'm going to list at the end of the presentation. So we know that nutrition plays a big role in cancer care, and there can be, there's a large continuum of nutrition issues that can occur from the time of diagnosis all throughout a patient's cancer care. And there can be different ends of the spectrum. So some patients who are undergoing chemotherapy or radiation may have issues with malnutrition and calorie loss, weight loss. On the other side of the spectrum, we know that obesity can really contribute to the development or increased risk of many cancers, including postmenopausal breast cancer and many gastrointestinal cancers. And so we have put a lot of effort into our nutrition program. We have a nutritionist, Ali Farley, who is part of our integrative program, and she does a lot of educational information, dissemination of educational information, including a nutrition blog. Right now, those of you who are on the email list have been receiving a summer recipe series, and she's also going to do a fall recipe series where she sends out recipes that she's developed with her nutrition background to help take advantage of summer produce and fall produce and popular foods that will be available. We also have a weekly farm stand, and she disseminates and develops the recipes in conjunction with the weekly farm stand. So Weekly Farm Stand is in partnership with Shalom Farms, which is a 12-acre sustainable farm in the Midlothian area. And every Wednesday they pack up and bring fresh produce to Massey Cancer Center, right outside where people pull up for the drop off. And this is just a sample of what kind of produce we've had available recently. But as I mentioned, Allie, our nutritionist, as well as Susan Chandler and many of our volunteers and others help with the farm stand, and patients, providers, and staff all can purchase fresh produce there, and also get recipes and ideas about how to incorporate the produce into healthy meals. Herbal supplements is always a popular topic that comes up, and we know that a lot of our cancer patients are interested in learning more about vitamins and supplements. And so with the help of Mandy Gatesman, who is a clinical pharmacist, pharmacy specialist on our integrative health team, we do a lot of education about herbal supplements. We know that herbal supplements are not regulated by the FDA or Food and Drug Administration. And so they can have variable potency and lack of standardization. So it's important to beware and be mindful of these things. We also know that different plant parts can have differential effects. And just because something is natural or derived from an herb doesn't mean that it can't have drug interactions. So that's something we have to be really mindful about when we're talking to patients, or if you're thinking about trying an herb or a new, vitamin or something that you've heard about. It's really important to make sure that you're talking to your patient, to your providers and your care team about it. So as an example, just to speak to the last point of the drug interactions, we do know that many of the herbal supplements, including things like garlic, ginkgo biloba, ginseng, and vitamin E, can actually increase the risk of bleeding. And so again, it just highlights the importance to make sure that you're really communicating with your care team about any sort of herbal supplements that you might be interested in. And we will have more programming in the future too, about education about herbal supplements, if you're interested. This is Monet Bailey. She's our licensed cosmetologist through the Integrative Health Program, and she runs our Magical Touch Wig Salon. She's available by appointment to help with wig and skincare. And she's also putting on a virtual series called Confidently Me, where the skincare and makeup is provided to patients, and they can enroll and learn how to sort of make the most of their skincare while they're undergoing treatment or beyond. I mentioned that we have a lot of educational workshops and classes, and we'd be interested if you have other ideas for workshops and classes that you might be interested in. We're always looking to hear from patients and providers and caregivers about what people are interested in so that we can tailor our education. We have support groups. This is a few of them listed here. And then I just will leave you here with sort of my global vision for the program. We're really working to grow our program to include personalized and/or group offerings from all the major integrative modalities that I had mentioned on the prior slides. So we've got a lot of programs already, and our integrative health program is really growing by leaps and bounds. We really want to cultivate a culture of wellness that is addressing the whole person. So we recognize and celebrate that, patients are not just a physical being, we're physical, emotional, and spiritual beings. And so we really want to incorporate therapies into the care plan at the time of diagnosis that are individualized and take into account all of these aspects of an individual. We are also working to become a local and national leader in integrative research and education. So we are, as we develop and implement our programs, we are very interested in collecting data on how these programs are impacting our patients. And then education. We are very passionate about patient education through workshops and seminars, but also, trying to be available again and flexible about what you all are interested in hearing more about. So please give us that feedback. This is just some resources I've listed. So for more information, we do have, as I mentioned, Integrative Health phone line. We have an Integrative Health website, which has just been updated. I also put some resources here that are outside of Massey Cancer Center, but can be very helpful. So one very good and reliable evidence-based source that I found for education about herbal supplements specifically is the Memorial Sloan Kettering Cancer Center About Herbs website. And so they've got a whole page where you can search for different supplements and read about which ones have evidence behind them and which ones may pose different drug interactions and things like that. The Society for Integrative Oncology is really a leader in terms of research for different integrative therapies. And so they have a website that can be very helpful and a wealth of information. And then, of course, the National Cancer Center, or the National Center for Complementary and Integrative Health, which is a subshoot from the National Institute of Health, has very good and reliable information on these types of therapies. And with that, I want to thank you all for your attention. And I'd be happy to take any questions or comments if you will put them in the chat. Thanks again.
Thank you, Dr. Ross, for that comprehensive review of integrative health, and especially of integrative health at Massey. Just for the benefit of any current or future viewers, you talked about the importance of clinical trials. And so just in case someone is interested, how would they go about becoming involved with a clinical trial?
Yeah, that's a great question. So we have several clinical trials that are open and enrolling right now at Massey, and those are all searchable on the website, and we can put in the chat the exact website, but those are all available through the Massey website. You can actually search in terms of what type of cancer you have to see what trials may be available. There's also a national site, which is clinicaltrials.gov. And that is a website, again, it's available to the community. And if you go to that website, again, you can search for clinical trials that might be open and enrolling either for the specific type of cancer that you have, or if you're interested in an integrative therapy, there are several integrative clinical trials that are actively enrolling on that site as well. And you can also, it's pretty user friendly, because you can put in, if you do an advanced search, you can even put in sort of your geographic location, age, and other features, so that it can try to tailor your search so that you can find something that might be a good fit.
Great. Thanks for sharing that information. I entered it in the chat box.
Great.
And of course, just it's Massey's integrative website is very easy to remember. It's just masseyintegrativehealth.org.
Yeah. And
there are links that can take you just about anywhere else to the website if you would like to look on there. You mentioned a bit about herbal supplements and drug interactions. For those people who may currently be involved in chemotherapy, can you list a couple of supplements or other products over the counter that they might be particularly aware of, and make sure they tell their doctors that they're taking them?
Yeah, I think in general, it's really important, especially if you're going to be undergoing chemotherapy, but really to, write down, before you come to your appointment, all of the things that you might have in your cabinet or what you're taking at home. Because I do think that sometimes people forget that herbal supplements, are medications, and so are different, over-the-counter medications. And so you really want to share any of those that you're taking with your care team, because they can definitely have real drug interactions that could potentially, lead to different side effects, or potentially, change the efficacy of one or the other medications. So the ones that I had mentioned earlier, some of the ones that come to mind that may increase the risk of bleeding would be things like garlic, ginkgo biloba, ginseng, vitamin E. And for most individuals that may not be an issue, but if you're getting chemotherapy, or if you have a cancer that can affect your blood counts, like your platelet count, that may really, that could become problematic. So I think really any of the herbal supplements that you're taking, on a regular basis, you want to share with your care provider to make sure that that's not going to be an issue.
Of course. Thank you for that. And then initially you began this presentation talking about the difference between, and the old definition, or how this was identified, the definition between alternative and complementary or integrative. Anything else that you'd like to say about that, since people do tend to combine the two or confuse the two, alternative with complementary?
Yeah, I think it is really confusing, and a lot of that old terminology or nomenclature, still exists. And I think it's really confusing to try to tease that information out. As I had mentioned previously, conventional care or standard care or traditional care, those are sort of all terms that are used synonymously. Those are really based on rigorous clinical research. And so any sort of therapy that is marketing itself as replacing that or an alternative to that, I think really should be looked at with caution. Other red flags can be therapies that may be touted or reported to be, curative of multiple different ailments or cancers. Those should be sort of red flags that may not be a safe or efficacious therapy to pursue. So really, we're looking at the therapies that we support and that we endorse at Massey are therapies that are used in addition to the conventional care or standard care, and not as an alternative or not in place of.
Okay, well, thanks for mentioning the red flags. So very important, and how it can impact the outcome of your treatment too. So finally, if there was one thing that you hope listeners today take away from the information you shared, what do you think that might be?
I think the most important thing that I'd like people to take away from is that, these integrative therapies that we offer can be really helpful to take a holistic approach to care. And so I encourage you to explore them and to look into them. And most importantly, to make sure that you have, open communication with your healthcare team, to explore these that you're interested in, because I really think they can have a lot of benefits, not only physically, emotionally, but also to promote a sense of community and control and autonomy. So I think, make sure that you ask about these. If there's something that you're interested in, ask your provider about it, and maintain that open line of communication.
Dr. Ross, thank you so much for sharing your knowledge and your experience and your expertise with us today. We appreciate you being here and enlightening us about integrative health and cancer care. Thank you so much.
It's my pleasure. Thank you, Susan.